Hello everyone. For those of you who don't know me, my name is Beck. And this is my official first video as a registered nurse. So, really quick update. Yes, I am now a registered nurse. All of a sudden, bam, it's happened. I start my grad program in 2 weeks' time at the local hospital to me. I'm starting on a surgical ward and I've got a 6-month rotation there, and then I'll either go to med-surg or medical for another 6 months, and then I will be finished my grad program and see where the heck life takes me after that. But for now, that's not the point of this video. If you want an update to see where I'm at, all of the good stuff, go to my Instagram. It's nurse.beck. And yeah, I update a lot more on there with all like the juicy stuff and what's going on. And I do plan on doing like a series of like transitioning to registered nurse and how I go through my grad program and all of that. So definitely stay tuned for that. For now, today's video is actually a very exciting one. It is all about your aged care placement. So I'm doing a Q&A, but also an assumptions video, and then I'll also kind of go through my experience with aged care placement and how I went with it, and did I enjoy it, did I hate it, and what you actually do. So the first assumption, I've heard that it's very emotionally draining. It was definitely a bit of a shock to the system, all of a sudden going from, I don't know, just being a bit naive about life and life ending, to going to a place that people literally go to die. I know that sounds really morbid and horrible, but it's kind of the truth. Once you're in an aged care home, that's kind of where you are, yeah, until you go. So I guess for some people it could be emotionally draining, but my mum's a nurse and I feel like she's kind of prepared me a little bit for that side of thing because she worked in aged care for a long time. So yeah, it is a shock to the system and can be emotionally draining, but for me personally, I found it more enlightening and clarifying for me, and yeah, it made me appreciate life a little bit more. Assumption number 2, they get the students to mostly bath the residents. You definitely are doing more of a carer role, and that is a lot of like the bed baths and the showers. The thing with the facility that I personally went to, I wasn't allowed to shower them on my own. So a lot of the time you are paired just with a carer, and you kind of go about your day helping out them, and if you're in a morning shift that involves showering. So yes, you are doing most of the showers. I heard that it involves a lot of unpleasant tasks, example, cleaning up poo. I think that was the nicest way that anyone worded this. So yes, a part of your role when you are doing your placement in an aged care home is doing the unpleasant tasks. I've had actually a lot of people message me about this and asking me like, is it confronting? How do you deal with it? And so many people are like, ew, it's so gross, like that's so disgusting. But I've always kind of found it humbling, and I find that I want to make it the best possible experience out of a bad experience for them, because pretty much the reality is that a lot of us will be in that position when we get older. I guess to summarize that, the reality is that as a nurse, you are going to have to do unpleasant tasks. Even if you're a pediatric nurse, if you're a cardiac nurse, you're going to be dealing with human fluids, feces, urine, snot, earwax, blood, pus, everything. To me, I feel extremely passionate about helping people and ensuring that they feel safe and they feel cared for and they aren't embarrassed, and I'm treating every single person with the same dignity and respect as I would treat my own mum. Alright, next one. You're pretty much just a free carer during aged care placement. Yes, but also you're there to learn and you're there to experience what it's like in the healthcare industry. So you can feel like sometimes you're just there for free and you're doing all the work for other people, but I guess that's where you have to put yourself in the position to learn. Go into the room and do an A to E assessment on someone. Ask the nurse if you can do the vital signs rounds. Be proactive about it, because at the end of the day, if you want to go in and sit in the room with your patient and talk to them, get to know them, change their life just for 3 weeks, like I found that, oh my gosh, I'm getting so emotional about this. Oh, I found that I really wanted to connect, get to know my patients, get to know the systems, and sometimes that meant sitting in a room with a resident and learning what they like, what they don't like, learning how they feel about healthcare and how they feel about how they're being treated, so one day I can make it better. Asking questions to residents, asking questions to the nurses that are on as you go on with your placement. Like your first week, yes, you need to put in the hard work. You need to show that you are there to learn and that you are there to help. Like any placement, you want to be there to help, because the more that carers, the more that nurses see that you're there to help, the more opportunities that will come up. So my first 2 weeks of placement was basically spent running ragged, helping out wherever possible, making beds, putting people's socks on, rubbing people's knees with DP, showering people, like helping with assists, like helping with moving, helping with like hoisting people, everything like that. And in my 3rd week, I was lucky enough to get the opportunity to go and have basically a day with the nurses, a couple of days in a row, where I was doing vital signs. I was helping assessing people, kind of tagging along with the nurses rather than the carers, so I can actually learn that role. And that was really important. But it was also really important to learn how to shower someone, to learn how to be vigilant when you're showering someone, because in an aged care setting, as the carer or as a carer, you're the one that spots the deterioration, because you're the one that sees them every single day. You're the one that showers them, you're the one that assists them, you know their strengths, you know when something's wrong. And when you're showering someone, you can do a full top to toe assessment of skin integrity and notice any rashes, lumps or bumps or anything. There was some shingles going around while I was there, and I was able to be the first one to notice something different on one of my patients, which could have been shingles. Luckily it didn't end up being shingles, but I was able to advocate for my patient and say, I'm showering them, I'm noticing this rash. I'd get the carer, I'd be like, is this normal for them? And then it wasn't, so we took it to the nurse, who took it to the doctor. And that's a very important role and a very important skill to learn, because you need to be able to kind of pick up on things and figure out what's right and what's wrong and what's normal and what's not. All old people are friendly. Oh, no, don't get me wrong, you get some absolute lovely people, but you get some horrible ones. I did find that the majority of the people that were cranky, it was because they weren't getting the right care. I had this one lady who hated absolutely everyone. And so instead of just going along with what everyone else was saying and just being like, oh, she's an absolute cow, I'm gonna avoid her, I took my time to sit with her. She was an ex-nurse, and it was simply because people weren't listening to her that she was grumpy. She still was grumpy for the most of the time, but I was able to make an impact with her and get to know her a bit more, and even for the 3 weeks that I knew her, I was able to help make a difference in the care she was getting. So yeah, but definitely old people are not all nice. Not at all. Alright, it's really boring and repetitive. I mean, sort of, but every day's pretty different. It's very fast paced, extremely fast paced. So it's not sitting around waiting, you know, talking to people. This is one of the reasons I didn't like it. It's 7 AM, get everyone up, out of bed, showered, toileted, in the dining room for an 8 o'clock breakfast. Like, it's all very da 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 da. After breakfast, you take them back to their rooms or put them in the lounge room, or they go for activities, and you're, again, toileting, waiting till morning tea at 10 o'clock. 10 o'clock, you're doing morning tea rounds, handing out coffee and tea and biscuits. And then again getting everyone out of their bedrooms, out of where they are, and into the dining room again for lunch, feeding people, assessing people, and then after lunch it's afternoon tea at 2:30, and you're doing the same thing, coffee rounds. All in the middle of this, you're documenting, you're toileting, changing pads. There's lots of involvement. And then like 3 o'clock's handover, and then afternoon staff come on, they do dinner, and then getting everyone to bed, and then, but there's so much that goes on in between someone has a fall, someone has a skin tear, someone's crawling out of bed screaming out for help, someone's got really bad dementia, and especially in the afternoon when they're sundowning, you put them to bed once, they'll get out 10 times convinced that their room isn't their room, and you're spending 20 minutes in their room with them, showing them pictures on the wall, showing them that this is their room, and get them familiar with their room, and that's hard. So it can be like, you know, structured and repetitive, but there's always something different going on. Okay, questions. Ta-da! Did you hear any amazing stories from the patients? I definitely heard a lot of incredible stories, a lot of sad stories. Being a student, I got to kind of take people out for a smoke and sit outside with them and chat with them, or like just go and keep them company when it's in a flat stage. I don't want to just be sitting around chatting with staff members or anything like that. I want to be spending my time with the residents, because at the end of the day you won't get that opportunity again. So yes, I heard a lot of amazing stories. I can't really share any of them because they're all confidential, even though you have no idea who I'm talking about. I just can't risk anything like that. But yeah, war stories, ex-nurse stories, incredible things. Would you ever consider working as an RN in a nursing home? I probably would. Like, it wouldn't want to be my end game. If I was going to go anywhere other than a hospital, I would rather go to a GP clinic over an aged care home, just because the hours kind of suit me better and you're more involved with patient care. As an RN in aged care sector, you're kind of the boss a lot of the time. Like, there's not a doctor on, like, there's doctors on call, but you make the decisions. You are the like be all and end all, top honcho essentially. And I'm just not really suited to that. Yes, I can make decisions, and yes, I'm confident in my abilities, but I would rather be able to like have a joint kind of team framework to work with. Is there much clinical theory involved with aged care, or is it really very carer centric? The first half of it is centered around being a carer, but you still can apply a lot of clinical knowledge to that. Like I mentioned before, you can see them deteriorate. You will most likely be exposed to death, and you will be able to see the dying process. It is upfront, but you can make any experience or any role clinical. What did you feel most unprepared for? I guess the obvious one for that would be death. I did get to witness my first death on my aged care placement. The patient was palliative. I saw them a few hours before they passed away, and then afterwards, and I didn't really feel unprepared for it, but it was more of just like a, okay, yep, I'm about to see this, I'm about to deal with this, and that's okay. You can't really prepare yourself for that experience as such. Nothing will ever prepare you for that except going through it. What surprised you? I knew I always liked old people. This is probably where all my passionate drive comes from when I'm talking about this subject. I love old people. I don't know, there's just something about them that I just click with. I get along with most of them. Obviously not the really crabby ones, because they don't like anyone. They're just like a wealth of knowledge and a wealth of experience, and you can just pick at their brains, and it's just the best thing ever. When you noticed declined or damaged skin integrity, did your RNs take on what you said? So like I said before with the shingles, yes, they definitely did. You kind of had to earn your way, which is dumb, but it's just kind of how it is at the moment. Because you have a buddy carer, so you're partnered with a carer depending on your facility, they can kind of help advocate. So if you go to them and say like, look, I've noticed this, can you check this out? They would take it to the RN, or you would both take it to the RN. If you have a carer that doesn't take it on and you genuinely think something's wrong or something needs attention, that's when you go straight to the RN. And if they don't take it into consideration, you document that, and if possible, go to another RN on another shift. Just keep being a pain in the butt. If you genuinely have that gut feeling that something's not right, just keep going. Oh, just for the what did you feel most unprepared for as well? Seeing people in a state that isn't compatible with life, but they're being kept alive, that was hard. This one patient had a stroke. She was pretty young, she was palliated, and then all of a sudden she started eating again, and that brought her back. And so now she has a strict regime with eating. She can't talk, she thinks that you're different people, she cries all the time, and she just has to lay in bed. She gets showered in bed, everything, and she just, like, it's awful. And that shocked me the most out of anything, because that was just the most horrible thing to witness anyone go through. Okay, did you ever do suppositories? No, I actually have never done one, which makes me nervous going into being a registered nurse and never having done a suppository. But in your first year, or in my placement, I wasn't allowed to give any medication, and the suppository is considered medication. So yeah, I've seen one done, but that's about it. What do you actually do on an aged care placement? So I kind of explained this before, so I'm not going to go like too into depth with this. In the morning, you go in, you get handover by the RNs on each of the patient's conditions. It's usually very brief. Then once you finish handover, go and get towels and the linen trolley, and then go and get everyone up for bed, shower them. You're feeding people, you're pouring coffee and tea and drinks, you're doing thickened fluids. So it's when someone has a swallowing deficit, they need to have their drinks thickened, and they'll have also pureed food. You're toileting, making beds, like taking residents to their hairdressing appointment, like making sure the residents are okay, double checking on them. Things I feel I could have been more educated on. I guess skin tears, skin ulcers, vital signs. Your first year you're a bit like, oh my goodness, vital signs, like, but if you get practice with the elderly, if you get a chance to do that, then do it. The only other thing I would mention is a lot of the older ladies absolutely hate the automatic blood pressure cuffs. It hurts them, so if you can, always do manual. Someone just said, about to do my first placement, any tips, and did I enjoy it? Yes, yes, I did enjoy it, for sure. It taught me an incredible amount in my first placement. You don't think that it's going to teach you much, but then it does. So I guess my tips would be go in with no expectations, go in excited, and don't go in dreading, like don't go in there thinking that you're better than this placement, because a lot of people think it's wrong that you do an aged care placement first, and I personally think that it is the best placement for you to do first, because it like humbles you and it makes you realize that nursing isn't all about dealing with someone in cardiac arrest, doing CPR. It is being 100% a support for another human being who can't do something for themselves. So yeah, go in with an open mind and take this opportunity while you're a student to do stuff that you're not going to be able to do when you're a working nurse. Sit down with your patients, get to know them, take a moment to have morning tea with them, like just stuff like that that'll make a difference in their lives, and at the end of the day it'll make a difference in yours. And yeah, thanks for watching. Okay, anyway, goodbye.